Fox 10 investigator Justin Lum exposed what health officials call an unlicensed treatment center going on at a Tempe hotel. And taxpayers, that's you, have been footing the bill.
And tonight, we're learning more about NewFound Hope, the company behind the operation that's under state investigation.
Justin joins us live after confronting the CEO looking for answers. I bet he was thrilled to see you out in the parking lot or wherever you were.
John, Christina, both the state's Medicaid agency and Department of Health are investigating NewFound Hope. Records show dozens of people have been housed at a decommissioned Ramada Inn without valid licensing. The company is also accused of Medicaid fraud in the midst of a statewide sober living crisis. And we finally caught up with NewFound Hope's owner to see what he had to say.
No comments into you guys put facts on TV that are real, no fake news.
Do you deny the allegations of
absolutely
offering the services without proper clinical oversight or excessive billing?
I have no further comments.
NewFound Hope CEO and co-founder Denis Artiles never responded to us for our first report on his case. A little more than a week later, we found him after a private hearing with Access, the state's Medicaid agency. Since February, Access stopped paying NFH for services provided to its patients, accusing the program of fraudulently billing the state. NewFound Hope is appealing the suspension. Meanwhile, the state's Department of Health Services says NewFound Hope is housing patients at this hotel on North Scottsdale Road in Tempe, operating a healthcare institution without a license. Through our investigation, it was clearly business as usual for Artiles and his team, weeks after DHS issued a cease and desist. Are you guys still operating right now?
Yes, we are.
So despite the cease and desist, do you feel like DHS is in the wrong here?
Yes.
NewFound Hope's website says the program provided treatment and housing for Native American families. But DHS investigators reviewed medical records to learn that multiple patients should not have been admitted to the program due to having withdrawal symptoms. At one point, nearly 100 beds were assigned to patients at the hotel. NewFound Hope's attorney, Ashley Adams, answered our questions. Is there any acknowledgement of a concern that there are people there that are not totally sober and not fully detoxed, as said in these allegations made by DHS?
I think if the patients needed a higher level of care, our clients have enough professionalism and knowledge to know that they should have been taken to a higher level facility. So I don't think that was an issue at all.
DHS says patients were transported between the hotel and the detox center daily. Adams says investigators did not interview current patients and employees before the suspension.
They didn't do anything other than look at records, and they're trying now to impose a billing rate on providers that was not in place at the time, prior to all of these suspensions. So in essence, they're trying to impose a law on an ex post facto or a retroactive basis.
A spokesperson with Access can't discuss this case in detail, but says investigations done by the Office of the Inspector General are complex and require significant research. If fraud is suspected, law enforcement will assist in the investigation before suspensions are finalized. NewFound Hope is also appealing actions by the Department of Health. DHS says the hotel facility is providing a higher level of care than that of an outpatient treatment center, which could result in patient harm. Adams tells us no services are provided there, just housing. What can you tell me about if there were services or not?
Yes, there were services after hours. After groups ended at the clinics at 2 p.m., there were other classes that were facilitated at Ramada.
2 more former employees of NewFound Hope are coming forward and wish to remain anonymous. We'll call them Mary and Felicia. They describe being pressured to bill Access for as many services as possible each day.
Money, 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 money. Let's get this money and forget everything else.
Every day you're trying to hit a mark or a quota?
Correct. If we didn't meet that 6 units a day, best believe we were getting an email back from the owner himself who was not happy about it.
That owner is Denis Artiles, whose company is now accused of excessive and duplicate billing. Access says wide-ranging investigations found that people were aggressively recruited with false promises of food, treatment, and housing, yet providers billed for services that weren't given or necessary. NewFound Hope is on a list of more than 200 providers that Access suspended payment to, as the state has lost hundreds of millions of dollars in a Medicaid fraud scheme not only targeting Native Americans. And what about the living conditions inside the former Ramada?
Most units there were infested with bugs. ants, roaches, mice even.
Mary also says it was normal to see patients under the influence of alcohol.
NewFound Hope had a lot of clients come into the program that were not sober, and then there were also clients who would go out on day passes, for the week or the day or whatever, just kind of depending on the approval, and then come back very intoxicated. And some of them were allowed to just go to their room and kind of just detox it off.
In a facility filled with dozens of people and families with children.
It's very overwhelming. It's a good thing that a lot of our employees, my fellow employees, were knowledgeable in the recovery, treatment, and substance abuse field, because we did sometimes go in on a wing and a prayer.
Former employees believe the high volume and small staff caused case overload and bare minimum services. You wanted to do more, but it wasn't part of the game plan.
Yeah, all of us wanted to do more.
We have also asked Access how much money in Medicaid reimbursements NewFound Hope has received thus far, but we're told that the numbers can't be released due to the ongoing case.
Well, one thing we do know, NewFound Hope hasn't been paid by Access since February. We're talking 6 months. How are they even functioning when apparently they don't have any income coming in?
Yeah, that's another big question. I'd like the answer to that. They haven't been paid by Access and Medicaid funding. We have covered this scheme in the past in Praying on a People, where we've heard of people using clinics that were actually licensed to get paid to bill Access. Not saying that's what's happening here, but are they paying out of pocket and housing these people on their own dime? We don't know that. We do know for a fact, though, money hasn't been coming in from Arizona's
You wouldn't
Medicaid
think they could
agency.
exist under that circumstance.
Yeah, there's a lot of people.
6 months of not being paid?
Yeah, so that's definitely something that we like the answer to.
Somebody's paying rent, somebody's paying staff, so the money's coming from somewhere. But Justin, you mentioned there's some changes that have happened since your first report on this.
Yeah, we know that this was a decommissioned Ramada Inn. There was a franchise agreement that was no longer in place since 2022. The Ramada sign has been painted over in red paint. You can still see the Ramada lettering. The staff section on the website since yesterday has been temporarily taken down for whatever reason. Clearly, there is a state investigation ongoing by Access and also by the Department of Health. Clearly, that's what's going on here that we've been reporting on.
Yeah, if treatment was sketchy, it starts to look a bit like a flop house, to be honest with you.
Yeah, well, you're hearing from these former employees. You're now hearing from 4 former employees who said people have been coming in intoxicated. There's not a lot of supervision. And with these patients and these families, there are children that are being housed in here as well. So it doesn't look like the best situation, hence why the Department of Health is saying we want to get this place up to standards and up to health code.
Yeah, I mean, mice in there. You saw the conditions in those images. I mean, that's no way to live just for anyone. But
and Access doesn't just issue suspensions like this. They need some sort of law enforcement agency at federal, state, or local level to corroborate the evidence they have, so they don't just hand out suspensions, and we'll be keeping track of this case.
It's a process. Okay, Justin, thank you.
Thanks, Justin. For more information on the sober living housing crisis, and again, this is costing the state millions, scan the QR code on your screen. And if you've got a tip about this whole thing, email us at fox10investigates@fox.com.